What if a tiny cut, something as harmless as a paper scratch, could become a death sentence? What if your skin began to blister, then blacken, then rot? And worst of all, you stayed conscious the entire time. As your flesh liquefied from the inside out, this is the true horror of necrotizing fasciitis, a real rapidly spreading infection that eats your skin alive. Welcome to true medical horror, the scariest diseases you never knew existed, where nightmares wear lab coats, and every symptom is more terrifying than the last. If you're brave enough to uncover the darkest corners of medical science, like and subscribe now. Because the disease we're about to explore doesn't just kill, it devours. Necrotizing fasciitis is as brutal as its name suggests. From the Latin necro, meaning death, and fascia, the connective tissue under your skin. This disease doesn't politely knock, it rips through tissue, muscle, and fat like wildfire. In just hours, not days, not weeks, hours, it begins like any other skin infection, a cut, a scrape, a surgical wound, or even a bug bite, the kind you'd ignore, but under the right or wrong conditions. That tiny wound becomes the gateway to hell. There are several bacteria that can cause necrotizing fasciitis, but the most notorious? Group A Streptococcus. Yes, the same bug behind strep throat, only this time it doesn't stop at your tonsils. It dives beneath your skin, multiplies rapidly, releases toxins that shut down blood flow, and starve your cells of oxygen. Your tissue begins to die. Pain is the first sign, but it's not normal pain. It's unbearable. Far worse than the wound suggests. The skin might still look fine on the outside, but beneath it, your body is rotting. Swelling follows, then blisters, then skin that turns purple, black, and eventually sloughs off completely, like wax melting off a candle. But you're not dead yet. You're watching it happen. You feel it happening. The infected area smells foul, putrid, because it's decomposing while you're still alive. Fever sets in, then confusion. Then your blood pressure drops. Your body slips into septic shock. Organs fail. And without immediate intervention, you die. Even with surgery, IV antibiotics, and intensive care. 1 in 3 patients do not survive, and survivors often lose limbs, skin, or muscle tissue. Sometimes all of the above. Let me tell you about Aimee Copeland, a 24-year-old graduate student in Georgia. In 2012, she was ziplining with friends when the line snapped. She fell and suffered a deep gash in her leg. It was treated with staples. Everyone thought she'd be fine, but within days, her leg was swollen, burning. She described the pain as beyond childbirth. Doctors quickly realized necrotizing fasciitis was eating her alive. She was rushed into surgery. Doctors amputated her entire left leg, then her right foot, then both hands. They cut away every inch of dead tissue to give her a chance at life. Aimee survived, but her life was permanently changed. And yet, she's still alive to tell the story. She's become a public speaker and advocate, raising awareness for flesh-eating bacteria and reminding us all that even a small wound can open the door to something unthinkable. Necrotizing fasciitis can strike anyone, healthy people, young people, even athletes. It doesn't care who you are, only that you're alive and warm, because that's all it needs. Early detection is your best hope. If a wound suddenly becomes excruciating, swells unnaturally, or changes color, seek help, fast. Every hour counts, because once the infection spreads, the damage is irreversible. They call it a flesh-eating disease. But that's an understatement. This isn't just a disease, it's a predator. It creeps in quietly, then consumes violently, until all that remains is bone or memory. So the next time you brush off a scrape, ask yourself, what might be lurking beneath your skin? Thanks for watching True Medical Horror. Subscribe for more real medical nightmares, and remember, some diseases don't wait to kill you. They eat you alive.